Good afternoon. I'm Dr. Fankhauser, Thomas Fankhauser, and I have a dental practice here in Wichita, Kansas. And today we're going to talk about implants. And for people who have a fear of getting an implant put into their mouth, okay? When I'm talking with patients about replacing either a single tooth or a few teeth, or using implants to help support a loose denture, you know, one of the main things, main concerns that people bring up is, well, gosh, I'm so afraid to have that done. You know, it sounds like it might hurt, and you know, my body might reject it. Let's talk about those issues today, and not so much about what it costs, but the two things I want to get across is that the first one is that the bone itself, where you put the implants, doesn't have any feeling, so there are no nerves in there. There are nerves that run through the bone, but you don't put an implant into that. You put an implant in the pure bone, and there are no nerves there. There are nerves at the entry site. Many of the implants today can be placed without what we call an open surgery. Basically, you just make a hole and put the implant right through the gum tissue. There's relatively very little post-operative discomfort doing it by that process. So it's no more there's really no more pain involved in that than if you might bite your own self on the tongue, and it might be sore for a day or two, but you know, for crying out loud, it ain't going to kill you. It's just not that bad. So, you know, if you are a person who gets really uptight about that sort of thing, then I would recommend doing the procedure under sedation, where you are comfortable and relaxed. We've done that before very successfully. So, the other thing is, you know, my body might reject it, or will my body reject the implant? Most of the implants today are made of titanium, but at the tissue level, it really doesn't make any difference that the implant is titanium, because the surface of the implant is an oxide. So the surface molecules of the implant are oxygen. You can't reject oxygen. Oxygen is you know, is part of you. So even if the implant itself is metal, it has an oxide coating, and so you know, it's practically impossible for you to reject it. Now, there are things that can happen. Number one, if you have periodontal disease present in your mouth, then an implant may not make it for the same reason that the tooth didn't make it, that your teeth didn't make it, because of the gum disease. You absolutely have to have control of periodontal disease process. Implants, however, will not decay. There's nothing there to decay. So another reason that you could lose an implant would be that the doctor has not adjusted your bite to keep the stress off of the implant while it is being integrated into the bone. So in other words, it will get beat to death or loosened up by chewing on it improperly. But that's not the body rejecting it. That's poor technique on the part of the dentist, because the bite should be adjusted correctly and the implant should be left out of function long enough to tighten up. The only other reason it might be lost is if you're a heavy smoker or an uncontrolled diabetic, and in a few of those situations, but those things can be overcome and addressed with your doctor. So don't be afraid to get an implant. It's just not that it's not that big a deal anymore. It's like somebody being afraid to get a filling 50 years ago. Yeah, maybe they didn't use anesthetic, but today getting an implant is just not that much of a problem. So if you need one, go out and get it. It'll be good for you. That's all for today. Thank you very much. For more information, go to the website below or call the number on the screen. Thank you.